She's a registered nurse and has more than 16 years' experience working across multiple hospitals within New South Wales. And she's currently working as a CNC in orthopaedics at the Sutherland Hospital in Sydney South. She places great value on the multidisciplinary team support to implement improvements in orthopaedics and in patient engagement and education. And in 2022, Sutherland Hospital was the winner of the registry's Golden Hip Award for the most improved hospital. So take it away, Juliana.
Thank you, Juliana.
Hello, I'm Juliana Zvavanjanja. I'm the CNC at Sutherland Hospital. I've been in this role since last year. I'm here to talk about the hip fracture care at Sutherland Hospital, which resulted in us getting the most improved golden hip last year. Sorry. So I would like to acknowledge the team that was working at Sutherland Hospital during that time. There were a couple of projects at the hospital between 2019 and 2021, which resulted in improvement of the care of the patients at Sutherland Hospital. Next slide, thank you. And then there was a couple of projects, as I mentioned, that were mainly for the district, or either they were focused on the NOF standards. So the district-wide projects were to improve the clinical care standards in identification of delirium and managing delirium. So there was, it was realized that the cognitive assessments were being done poorly. Essentially, they should be done within 8 hours of admission, and escalation was poor as well for those patients. A review was done to align the care of the patients as well during that time in 2019 all the way to 2020 to align the care with NOF standards. Next slide. Thank you very much. And the key changes that were implemented at Sutherland Hospital was they decided to have a NOF working party, which ran for about 6 months. The agenda was to review the standards and how we were faring compared to the standards of the NOF patients. Data collection responsibility was decided as well. So previously, before that, data entry into the Australian New Zealand hip fracture registry was not allocated. It was whoever amongst the doctors thought it thought they could do it at that time. So they decided the senior RMO would be responsible for that, and then the data collection processes as well were decided in that meeting. There was also a lot of push to manage the delay to theatre, particularly surgical list during the weekend. And this was something that theatres had to start having a dedicated trauma list on a Saturday and a Sunday as well. Next slide. Thank you very much. So these were the data collection points that were decided mainly to match with the Australian New Zealand hip fracture standards. And also the notification of the arrival of the patient from emergency as soon as it was confirmed that they had a NOF hip fracture. Go on to the next slide. Thank you very much. So from the review that they did to match the care to the NOF standards, they decided to focus on the pain management, particularly at triage. So not many patients were getting any nerve blocks whilst they were in the emergency department. From that, the consultants and the ED verbalized that they would like to do it, but they were not trained to do the fib blocks. And then also pain assessment with a triage. It was noted to be, sometimes it was done, sometimes it wasn't done. So there was extensive education of staff, the nursing staff, and also led by the triage nurses in the emergency department as well. As I mentioned, there was not a notification system that would go to the aged care orthogeries, or that would go to the anesthetics as well. So at that time as well, they focused on that. We should go via switchboard. Next slide. Thank you very much. So in terms of the cognitive assessments, there was a district-wide push for completion of the AMTS on admission. And from that AMTS, there is an automatic firing off of the CAM so that staff attended after they've done the AMTS in the admission form. This is a system-generated one. And for the consecutive cognitive assessments, it would mean the staff have to do it if there's a change in condition, and also the patients get the CAM attended post-op on the next day as well. There was also hospital-wide education by the district delirium aged care CNCs as well. Ward champions were established to ensure that they would keep the momentum amongst the staff members to attend the cognitive assessments and to also escalate. And if they had any questions as well, the champions were there to answer those questions in terms of cognitive assessments. The educators and the ward champions attended some audits, and there was a great improvement on the attending of the AMTS within 8 hours to the ward. Next slide. Thank you very much. So these were the assessed statistics for us to have the most improved. As you can see there, we're kind of doing really, we're doing really bad. We had 46% patients were assessed within the first 30 minutes to emergency department. So on that, with the improvements that we initiated, we had 71% of patients being assessed within 30 minutes and having a nerve block attended in emergency. And also the cognitive assessments were 63%, and then we ended up having 98% stats for 2021. This improvement helped for us to have an early identification of delirium, and also it's a way to ensure that we escalate any concerns that nurses might have about the patient post-op or pre-op as well. And also, they assessed by our geriatrician. We had 84%. We're not. Would love to get 100%. We were not so bad on this one, but we would love to do more, obviously. So we improved to 93%. Our geriatric model of care is we have an aged care team that see these patients as soon as possible. Sometimes it's about twice a week if they're still in hospital, but we don't have a Monday to Friday every day orthogeries at Sutherland Hospital. Next slide. Thank you very much. Yeah, so this is our Sutherland team from this year. That's when we got the golden hip. We have a multidisciplinary team approach. Every day we have 11 a.m. multidisciplinary approach. In this meeting, there's an opportunity for physio, nurses, me as the CNC, the doctors to just look at the patient in a holistic way. And also the social work is there as well, so which ensures that the family are involved in any educational concerns are addressed immediately post-op or pre-op as well. That's all that we have at Sutherland Hospital. Thank you very much for having me.